Hi guys, welcome up to the Kelvin TV. On this episode, I want us to talk about the things you need to do for a patient before he or she will be taken to the theater or the pre-operative nursing care that you're going to do for a patient who has been scheduled for a surgery. Guys, I know say most of us have witnessed surgery or we have witnessed patient being taken to the theater, but we don't know the process that they go through, the step-by-step process they go through before the patient will be taken to the theater. That's the reason why this video is very important to you, and I will urge you to subscribe, like, comment, and please share for me so that we can reach wider audience. The first one that we are going to talk about is known as verification and identification of the real patient. So the first thing that you need to do is you need to identify the real patient that the doctor has scheduled for the surgery. So you need to know the real patient by getting to know the patient number, the real name, the age, and the type of surgery that the patient has been scheduled to undergo. So that's it. Then the next thing that you need to also do is you need to confirm that the consent form is signed. Confirm that the consent form is signed. So before a patient will be scheduled to go for a surgery, then that consent form here already signed. They have signed the consent form that truly the patient has agreed to undergo that surgery. So you need to check and see that the consent form is signed. So then the next thing is you need to check the vital signs. So checking of the vital signs will let you get to know whether the patient, there is some abnormalities or there is something wrong with the patient. You get to know. So you need to check the vital signs and make sure the vital signs are in the right ranges. You need to make sure they are in the right ranges so that should in case there is any abnormality, you'll be able to report faster. Then the next thing that you need to also do is you need to ensure that the surgical site or the place for the surgery is being secured and cleaned. One thing that I've seen is mostly we don't do it here. The place that they are going to do the surgery, you need to make sure that place is very clean. What cleaning with surveillance and other things, chemicals, so that that place will be sterile, because the place that they are going to do the surgery, that place needs to be a sterile place. So after you've firstly make the patient sign the consent form and things, so you need to prepare the patient by making sure the patient has shaved baby. Then you make sure that the private part and all those are very clean. Next thing that you need to also do is you need to remove all personal items such as rings. So nipa no share ring nipa no share earrings like watches and all those stuff. You need to make sure that all these things are not part of the patient. Make sure the patient, all personal items are being removed from the patient, because you mostly some instances are patients be more surgery ring so make sure all ring and personal items are being removed from the patient. Then you need to make sure you ensure fasting or the MPO method. Make sure the patient didn't or shouldn't take in anything by the mouth. Make sure that the patient will not take in anything from 8 to 6 hours. Don't let the patient take in anything to prevent aspiration and other complications during the surgery. Then the next thing that you need to also do is you need to administer the pre-operative medications. So the medication that the patient needs to take, like the Renges lactate more, the IV P more, and that pain medication, the antibiotics and all those stuff. You need to make sure that the patient will take in all those medications before the patient will be taken to the theater for the surgery. Then the next thing is you need to make sure that you give the patient a psychological support. Because they have told the person that please, you are undergoing or you undergo surgical pressure slow surgery, so if you've been at the recovery center before the patient will be taken to the when the patient comes, they will give the patient emotional support. They will talk to the patient, they make sure that psychologically the patient is ready for the term before the patient will be taken to the theater. Then the next thing that you need to also do is you need to make sure IV line is secured. you need to make sure you secure what IV line. Then make sure that catheter is also in place, because during the process, maybe the patient cannot wake up or stand up to go and urinate. So due to that, the patient needs to have a catheter, so that through the process, should in case the patient is going to urinate, the catheter is going to make sure it's going to empty the urine. You see me? Yes. Then the next thing is you need to also make sure you document everything after you are done with taking the patient. So you need to make sure you do documentation of all the things that you are going to do for the patient when you are done with the preparing of the patient to go for or undergo the surgery that he or she is supposed to go for. So thank you guys for watching. Keep on watching Kelvin TV. Please drop whatever video you want me, or whatever topic you want me to shoot on. Drop your video and I will shoot a video on it. The next episode